Good afternoon. I am Colleen Witosh, and I would like to share with everyone today when I was first diagnosed with stage 4 metastatic melanoma with brain metastases. I chose to go on to a phase 2 clinical trial in 2016. This was all so new to me and those around me, and we had no idea what was in front of us, including my oncologist and care team. I knew that my main source of information going through the clinical trial was them. I realized how important it was truly to connect with my doctor and my care team. We spoke about the groundbreaking combination immunotherapy treatment and how we were all going to learn from each other. My doctor sat down with compassion and said to me, "You're not alone in this." In that moment, I felt seen, not just as a patient, but as a person. From then on, I opened up more, felt truly supported, and became more comfortable asking the hard questions. That trust made all the difference, and to this day, my doctor and care team feel more like family. Building a real connection with your doctor and your care team can completely change your experience. With that, I am thrilled and honored to introduce the final panel of the afternoon, Partners in Care, Navigating the Patient, Caregiver, and Medical Team Relationship. This panel discussion is moderated by MRA's Stephanie Kauffman with panelists Dr. Lynn Schuchter of Penn Medicine and melanoma patient advocates Toni English, Brittanny Groover, and Robin Zimmerman.
Well, good afternoon, and what an honor it is to be a part of this panel discussion. But before we get in this panel discussion, although it's closely linked, we have received so many messages, both in email as well as direct messages through our social channels about advocacy, and that there's nothing more powerful than the patient voice than when it comes to advocating for research, funding, and policy around health research. And many questions that have come into us this afternoon is, feeling concerns around the funding that is at risk for places like the National Institute of Health, National Cancer Institute, the Federal Drug Administration, our congressionally directed medical research program. And the question is, well, what can I do as a patient? And we would just suggest that a couple of things that you consider. MRA, we're focused on our mission. We believe that cancer has no political party, so we try to be very agnostic around that. But for those of you who are very interested in making sure your voices are heard around sustaining valuable cancer research, we would recommend that you call or email your representatives and senators and urge them to protect research, share your personal story, because that's what matters, and then encourage others to share as well. We have some information for those of you who are in the room with us in DC on how you can do that, as well as we are available to you around that. So I think that's a perfect time for us to go into this conversation around the patient and provider communications. And I'm thrilled to be able to moderate this conversation about partners in care, navigating that patient, caregiver, medical team relationship. A melanoma diagnosis, I don't have to tell anybody in this room or those of us joining online around the world, it doesn't just affect the patient, it impacts our families, caregivers, the entire medical and care team that are working around the clock to really try to provide that best care. The relationship between these groups is absolutely critical, yet often very complex. And today we're going to explore the challenges and the opportunities in building stronger and more effective partnerships to ensure, of course, the best outcome for patients. And so we have this incredible panel bringing us perspectives from medicine, patient advocacy, and caregiving. So we'd love to dive in on that. And I'd like to start off, Brittanny, why don't we have all the panelists introduce themselves and their roles within this melanoma community. Brittanny, I'd love to start with you.
Sure. I'm Brittanny Groover. I was diagnosed with stage 3A melanoma in 2021, cutaneous. It metastasized to my lymph nodes. But my journey was a little rocky with the patient care, with my oncologist, with my dermatologist. It was a little bit of a rocky start to find someone where I felt comfortable to feel safe and like I was actually being given good care. So Whenever I was diagnosed, it was actually during the pandemic. So I did grow up laying in tanning beds, unfortunately. And not just tanning beds indoors, but also outside as well. I loved laying by the pool. I'm a summer baby. I'm a Leo. I love just the sun. I lived and died around the sun. And so whenever I became a young adult, I started going to skin checks, and the pandemic happened. 2020 happened, and I missed one skin check, and by the time that I went back to my dermatologist in 2021, I not only had cancer, but it had spread to stage 3A. And it's been a long journey since then, which I'm sure we'll get to, but it took a long time for me to find a care team that I can actually trust, and hopefully we can share some of that today, but I'll let some others introduce themselves first.
Okay, I'm Robin Zimmerman. I started first as a caregiver for my wife. She was diagnosed with melanoma in 2004. Great care team, but knowledge was limited. And the initial removal was, we thought we got it all. But to be safe, she went through a year of interferon. And about 6 months after that ended, she felt a lump under her arm. The melanoma had metastasized to the liver at that point, and then we had to transfer to Providence in Portland because they were a more advanced hospital. When we met Dr. Curdy, who was the right doctor. His life's ambition was to cure melanoma. I said that right off the start. So we did have someone that was very active in what we needed to do. She went through multiple rounds of interferon, or IL-2, and then without response to that, she did in 2008 go on the clinical study for ipilimumab, and also did not respond, and passed away then in May of 2008. Now I was educated, and I was advocating, and more education, and I was watching myself. I had a small spot on my chest. Went to my dermatologist. It was nothing, but the spot on my back I didn't know about was like a 0-stage melanoma. Caught it super early. So I have 2 stories of late stage and early stage. Much better to be early stage. And I had to watch my health because, hey, my daughter, my son, they'd already lost a mother. They couldn't afford to lose me. So from then on, I've just been an advocate and continued education since then for the last 17 years. So you tell me.
Hi, I'm Toni English. I was diagnosed in 2015 with stage 4 sinonasal mucosal melanoma, and I was told I had 6 months to live. I didn't believe that. I decided I was going to find a way to beat it. I didn't know anything about it, so I was naive enough to think I could. But through a series of events, I was sent to a very knowledgeable oncologist who had studied mucosal melanoma and knew what we were dealing with. Did a fantastic job with surgery, followed by radiation, and sent me home and said, "You don't have cancer anymore, you're fine." I went back for routine scans, and 1 year later, in a 3-month period of time from being clear to being full of metastases, I had 3 brain mets. Both lungs were full, and a right kidney decided it wanted one too. So we decided we would start immunotherapy, did 8 series of Keytruda with no response. They were still growing. Then we decided to do Ipi-Nivo combo, the famous one that puts everybody in the hospital. So we did that. I had gamma knife radiation on the brain mets, and it worked. It was great. So took those off the table. But we were still dealing with these other large tumors. And as I recovered from the side effects of the Ipi-Nivo, went back in for a routine visit and sat down with my doctor, and I didn't know of anything else you could do. I thought that we had tried everything we could. So when I sat down with him and I said, "Well, what do you propose we do next?" And he presented a clinical trial, and it was for the TIL therapy. And I trusted him. He'd been so fabulous in all of my care. He explained to me what a clinical trial was, first of all, because I didn't know. And once he explained it and what it was, by that time I had found the mucosal melanoma community, the international community through social media, and I began to understand what mucosal melanoma was and how rare it was and how aggressive it was. We needed to find something that would cure it. And so I told my oncologist, I said, sure, I'll do it. Even if it doesn't work for me, it will help mucosal melanoma, so we have to do this. So we set up this procedure. There was, as you know, clinical trials are extensively laborious. And we got everything in place and ready to go. On April 2nd of 2018, I received my TIL therapy. And I thought I wasn't sure what was going to happen, but I was in excellent hands. The team was very good at the care that I received. 6 weeks later, when I went back in for my first checkup, the doctor had my tumor, or my scans up on the screen, the before and the after, and he was pointing at it, and he said, do you see that? And I said, what is this? Those are my lungs. What am I supposed to be seeing? He said, there's nothing there. It's gone. And he was more excited than I was, I think. But we continued with it, with the checkup and the follow-ups. 6 months after I received my TIL, all of my tumors were gone. And so I have been celebrating 6.5 years being free of cancer. I have used that to drive my passion for helping other people diagnosed with mucosal melanoma through the international social media that we use in order to connect, to share what's going on in research, to share hope, and to share the energy that's needed to help somebody get past that diagnosis and help them find their fight. So I advocate and support and mentor those newly diagnosed because I'm here today.
These are just incredible, incredible stories. My name is Dr. Lynn Schuchter. I am a medical oncologist, and I have the honor of serving as the director of the Tara Miller Melanoma Center at the University of Pennsylvania. And I feel really honored to be joining this amazing panel and all of you. I joined you for your lectures today, and I'm impressed how much you've understood, that you're still here, and your commitment. And I have been a medical oncologist for more than 30 years and focused on melanoma. And I feel as committed today to this disease as the very beginning. And it was a patient with a rare type of melanoma. It was a patient with a subungual melanoma, so of the nail bed. She had a melanoma on her thumb, and what struck me then, 30 years ago and now, is that it required a team to take care of that patient. And I trained at Hopkins, and not everybody there was an expert and knew what to do. And the field allowed me as a fellow to call people all around the country to figure out the very best treatment for that patient. And that really is why we're here today, is the same. Multiple teams, multiple researchers coming together to have these incredible stories. You've heard stories of real success here. I mentioned I direct the Tara Miller Melanoma Center, and Tara died from metastatic melanoma. It traveled to her brain. She was only 28 years old. But sitting to my left is this, amazing success story. So that's what we want to talk about today. How do we help every patient get the very best care and support them and their families as they go through cancer diagnosis, melanoma diagnosis? So we are looking forward to the conversation. I want to thank MRA for gathering all of us. Such critical work. Thank you.
So one of the things I hear from our patient community, I see it on social media, and having lost a dear friend over 20 years ago to melanoma that metastasized to her brain, How do you respond, and I want to start with the patient community, and then Dr. Schuchter, I want you to also give your perspective as a luminary in this field. How do you respond to anyone that you're in conversation with, and you've mentioned I've been diagnosed with melanoma, and it's dismissed as like, oh, that's nothing, that's easy, oh, it's just skin cancer. What's been your response on those conversations? And Robin, I want to start with you on that one.
Well, with me, yeah. Actually, when we were first diagnosed, that's what we actually said. Oh, it's only skin cancer, because, we haven't been educated. Of course, it's 2004. There really wasn't a lot, in the news about it, or no one really talked about it. We had some friends that, had gone through cancer, and she talked about, oh, I'm getting interferon shots. Oh, well, that's not as bad because it's not a big bag of stuff that you're sitting for an hour with. But, it was just the lack of information about it at that time. And until we learned, it took literally going through this in years for me to fully understand what melanoma is. And that's why this is so great, because this is getting the word out. Much more people are educated and understand and know how serious it is than they ever did back, 20 years ago.
Brittany, what about you?
Yeah. I
'Cause
remember.
You've got such a strong presence on social media especially.
Yeah. So I remember whenever I was young and tanning, I was like 12 when I started tanning in tanning beds, and my mom always gets mad at me when I tell this story. If you're watching, Mom, I'm sorry, Mom. But I remember whenever we would walk into the tanning salon for the first time and make her sign up for our subscription, they would hand you the paper that you had to sign off that you couldn't sue them if you got skin cancer. And in my mind, as a young child, I was like, well, it's not a big deal. It's just skin cancer. That won't happen to me. And then fast forward, I was 27 years old, and it did happen to me. And not only did it happen, but it also spread to my lymph nodes. And I had to do a year of Keytruda myself as well because of that. But now that I've learned so much about skin cancer through my peers and online and with MRA and everything, I actually wore a skirt today specifically because I like to show my scar. My scar was on my shin. You might be able to see it. It's right here. It looks like a football. It looks like a fist on my shin. And whenever my son's friends come over and they're like, "What is that?" And I always say it's a shark bite, and they laugh. And then my son says, "No, it's sun cancer." He calls it sun cancer. But what I do now is I wear it proudly. I wear it openly when I can because it strikes up conversation. People randomly in the grocery store will look at it, and if they're too hesitant to ask me what it is, and I can read their mind, and I know that they're wondering what is that big chunk of scar off of my leg, I'll just say it's skin cancer, and I'll just say it out loud because it's a way to open up the conversation, because a lot of people still do think it's just skin cancer. So just openly trying to talk about it and advocate, and then every once in a while you have to fight against the comment warriors on Instagram that say that it's not that serious.
Toni, you were diagnosed obviously with a very rare form of melanoma. So you've got melanoma writ large that is a conversation where, well, it's on your skin. And in the case of mucosal, what were those conversations like for you initially?
When I contact somebody new who's just been newly diagnosed, they're so confused because, again, they think, how can I get cutaneous melanoma there? Well, it's not. It's different. So explaining that difference. The scarier thing is that they say they've been diagnosed by a doctor who's never heard of it before. And that's the worst part because they don't know what to do. They can't offer them any help. They go to the internet to find out what it is, which is the worst thing they could do. And so helping somebody understand what it is, why it's different, why it has to be treated different, why you have to go in a different direction than somebody with cutaneous would go. They say, well, I know somebody that had skin cancer before, and they just had to do this or that. We're on a different journey. This has to be done in a different manner. And helping them understand that you need to find somebody who's knowledgeable, which is hard to do. We need more. I help them understand that they have to learn how to advocate for themselves, speak up and ask those right questions, because that's the only way they're going to get the things they need. There's just not enough knowledge about it out there.
I think all of us in this room and those of us joining us online, melanoma is a very complicated disease, and it travels fast. And certainly early detection helps that, but in an advanced stage, it's really insidious. So in this particular case, Dr. Schuchter, what challenges do providers face when explaining a complicated, complex melanoma diagnosis and treatment options, while at the same time trying to create that space for open dialogue and trust?
Yeah, it's such an important question. And at the beginning, patients are seeing multiple different types of physicians. They will go to the dermatologist for a biopsy, then refer to a surgeon, having some of their questions answered. Then some patients refer to a medical oncologist. And, no one ever wants to see the medical oncologist. And to your earlier point about people have skin cancer, they're not usually going to see the medical oncologist. And so I would say that in my experience of seeing patients is a lot of spending time, a lot of education. People don't know what melanoma is. They may not understand the seriousness of it. And patients come in feeling fine. They look fine. They have no symptoms. They can't understand that when they feel fine, look fine, even if they've had maybe scans, they're normal, that they still have a risk that this could come back. And so I do think, as you've already pointed out, really important to take the time, especially with that first visit. I think patients and their families are really bewildered by the medical complexity of it in that first visit. It's always good to bring a second pair of ears to that visit, because I think patients really only retain a small part of what we're talking about at the beginning. Some patients come in really, really prepared with lists of questions, and I do always think it's great to bring in questions. And some patients don't know anything about the disease, and it's somewhere in between. And some patients have a helpful relative that's really not so helpful, and sometimes that person is really key. So I just would say that it takes time to fully understand the diagnosis. It takes time to understand if we're having complicated decisions and discussions about treatment, what those side effects are, how we monitor, who is a part of the care team, who's in charge, is there a quarterback, why am I seeing so many different people? So I would say that it takes several visits really to begin to really understand the diagnosis, what the right monitoring plan is. But, key is listening. And, I'll be curious as we have more conversation now with the electronic medical record and we're typing. So this issue of first actually maybe not listening to the patient and asking the questions that I need to answer to type, but it is really important that we are sitting, that we are looking at our patient, that we are talking, we are asking questions and giving them time to answer that question. And I would just say really important that we're not typing at the same time. And the way the rooms are set up now, it often is not conducive. So I would be adjusting my furniture so that I could really talk to you. I rearrange people because I want the patient right next to me and family members, over. But I would say just some of your earlier questions, it's key that you feel comfortable asking your questions, that, part of it is really good that you can communicate in the chart and send a message. That's only going to go so far in terms of how detailed those answers are going to be. But take the time with the provider, get as much information as you need, make a follow-up visit. If we didn't answer all of your questions, call. We do want you to be fully equipped and knowledgeable about how to advocate for your own health, how to make some of these complicated decisions we're going to talk about.
So on the flip side of that,
Away
from
from you now.
yeah, on the flip side of that, from the patient side, when all three of you may get inquiries because they know that you're now this incredible voice for melanoma patients, and they come in like, I have this diagnosis. What are some of the things that, through your journey and through your experience, would you tell yourself now about what should I ask questions around? Should I brought a caregiver? What would, if you were stepping into that space of diagnosis now, what would you tell yourself, and how would that help others going through this? Brittany, let's start with you.
I wish I would have done a lot more, because whenever I got into my melanoma diagnosis, I had actually lost my dad young. I was 12 years old when he died of MS, and at that point, I kind of put the healthcare system into the trauma box and didn't want to deal with that. But then I got diagnosed with cancer, and I had to hit it head on. So whenever I got diagnosed, I had told myself that I didn't want to look online. I didn't want to go on Google. I didn't want to do that type of research, because you go on WebMD and it tells you you're going to get cancer and die. Well, I already had cancer. So I said I was going to trust my oncologist 100% of the way. And that ended up not being the right decision for me, because for whatever reason, my oncologist just, whenever I was going through immunotherapy, Keytruda, I had gotten colitis, which is a very common side effect of Keytruda. And so I was having explosive diarrhea, and it ended up going on for 6 months straight. And I kept asking my oncologist, why is this happening to me? And she kept throwing me over-the-counter medicines and saying, it'll go away, it'll go away, it'll go away. It's just the treatment. And instead of, I didn't go online, I was just trusting my oncologist. It felt like I was in the office with her for the 15 minutes, and then once I left the office, I had to deal with the pain and the agony, and my quality of life 24/7 was terrible and painful. But then the 15 minutes that I was in the office with the oncologist, she would just brush it off and be like, it's okay, and get me out of there. And I just wasn't brave enough to stand up for myself, and I allowed that to go on for 6 months straight until I ended up getting a pancreas attack, pancreatitis. I was in the hospital right before Christmas. My son was 5 at the time, and a lot of it I feel like is my fault, because I didn't push hard enough. I didn't ask hard enough questions, but I just don't understand why my oncologist wasn't taking me seriously. And so I don't know what I could have done differently other than just ask to see somebody else, a second opinion. But I just don't know. Those questions still race in my mind.
Toni, what would you recommend around someone who reaches out to you, or now that you know what you know in your process, if you were stepping into it, all those years ago, what would you tell yourself today as you stepped into that patient-provider relationship?
I think I should have learned earlier on how to be an advocate for myself.
Yeah.
Write down questions before an appointment so that I don't forget them, or get nervous or get sidetracked while I'm in the office, to make sure that I get my questions answered. It took me a while to catch on to that, and so now that's a big deal when I am mentoring a newly diagnosed patient, is to say, you've got to learn to have a voice. You are a part of the care team. You're vital in what you want and what you need to know to make you comfortable. Don't be afraid to ask those questions. Telling someone that it's okay to go get a second opinion. Who would have thought that it was okay to do that?
Yeah.
We might offend the doctor. Well, if your doctor's offended, you're at the wrong one. Because, and with no apologies. But seriously, when you've got a rare cancer, and you need to make sure you're getting the best possible care from somebody who knows what it is, it's important to have the information to know what's going on. Don't be afraid to ask questions. Mm-hmm. If the doctor says, well, we're going to do this, that, and the other, and they're over there typing and doing that stuff, and say, can you explain that to me, please? And learning how to do that, and now helping somebody else understand why that's important, leads to the success in your care.
That's a big one, if I can add. Yeah, you can fire your doctor at any time. Just because they're your doctor now does not need to be, if you're not connecting, if you're getting red flags. And even I live in a very small town where there's probably only 5 oncologists to pick from. But I didn't have to stay with the one that I had the whole time that wasn't helping me through all of the situations I had. So I definitely would have told myself sooner to switch and find. I've done it with my dermatologist now. I've switched to a new dermatologist who I love. I went from like an 80-year-old old man who was seeing a bunch of other 80-year-old old men. I'm a 27-year-old girl. It just wasn't a match, and that's okay if it's not a match. It's okay to seek out and switch your doctors. That's, yeah, something I was way too afraid to do, and I wish I would have done sooner.
And
I'd
can I
say
just,
go in with a proactive attitude and find a doctor that reflects that back at you.
Absolutely.
Dr. Schuchter, I'd love to get your perspective around this as well.
well, and I wanted to add, to take advantage of the whole team. And so the nurses, the nurse practitioner are a really important part of the team, and especially when it comes to side effect management. And so thinking that you only have those 15 minutes with the physician where, I mean, so many members of the team are really experts. And so making sure that you take advantage of the whole team. If there's a pharmacist, also can give a lot of information, the social worker. And I can't let your comment go that you said it was my fault. No, it wasn't. You were explaining your symptoms, and it makes me sad that somebody didn't recognize the side effects of the immunotherapy. And I work with first-year medical students, and we talk about the importance of listening. I explicitly say that if a patient asks about getting a second opinion, you should help that person. You shouldn't get defensive. You shouldn't get all bothered by this, that patients should have a choice of seeing other people. And sometimes you'll hear over the next 2.5 days, it's not everyone, the approach is not identical. Many things we do have a consistent plan, but other things in terms of how we approach, there really is different ways that this could be handled. So I love what you are all saying about your voice and how to get comfortable with the power of your voice. I hope we in the medical profession are also getting much better at listening and hearing, which is so essential. But you're arming yourself with education, which is the most important thing. But it does get hard, I think, when you feel responsible for making the medical decisions. I mean, asking earlier, should I be really specific about where my biopsy goes? Like, taking on the responsibility that you have to be the patient, make decisions, and try to like Dr. Google, that is really, really hard to do. And so you are all doing what's so essential, is getting the information, and that's what our advocates do, helping others to get the information so that you're prepared for whatever steps happen, during a particular course of melanoma. And I started to talk about it earlier, but when I am at that first visit, you have to decide how much to talk about during that first visit. It can be overwhelming. So also, you'll see that maybe we don't cover every single thing in that first visit because that is just too overwhelming. And you begin to learn, as you're working with patients and their families, how much they can take of the information at that time. Should you set up a follow-up visit to talk more about those details? And so I think that's really important as you talk about getting that relationship with your physician, with the nurses, with the team, that you're able to communicate. You mentioned trust and the ability to communicate, get calls back, address urgent symptoms that you're having is all such an important part of the care every day.
Let's talk a little bit about the caregiver role in families and their involvement, or that person that you take with you. And I have had the blessing of being a caregiver in a number of ways to loved ones who've been impacted by a cancer diagnosis in different ways. And the first thing I would hear, and certainly heard it from my mother, was like, oh, I can't ask questions, right? And similar to that, and I'm like, well, but I can, and I'm happy to do it. Well, you don't want to offend. I'm like, I would say to my mother, look, I'm really good at my job, and I know that these physicians are really good at their job, but I'm really good at my job. And one of my jobs is to kind of navigate some things, so let me help do that for you. But there's a flip side to that, right, in terms of the caregiver role, and particularly in that relationship with the provider community. So I would say, I'm going to start this one off back over to you, Dr. Schuchter, and then I want to get to the panel. How can caregivers really balance advocating for their loved ones, but respecting the patient's autonomy? And then how is a provider role to help not manage a family dynamic, but really kind of navigate that a little bit? So I'd love to start with you on that one, Dr. Schuchter, and I'll go down the line.
Yeah, I mean, I think it's very individual how this happens, and, what those relationships are like prior to a diagnosis, often does play out then, when somebody is going through a challenging situation. So I would say that, I'll get in a little bit of trouble for this, but I will just say that women, and Robin, I'm going to want to hear your perspective, but it does happen more that the wives of my patients are super informed about what's going on.
Yeah.
This is one thing that drives me insane, is when I'm asking my patient about their family history of cancer, and then they turns to his wife to answer the question. But I just would say that the role of the caregiver is so hard because they're trying to be a cheerleader. Sometimes they're in charge of managing the medication, they're coordinating the appointments. They have their own emotional reaction and fears that their loved one is going through. And so I think it's so important to pay attention to the caregiver, attend to what they need, what information they need, because they're often managing really complicated situations. And they can get drained as well, emotionally and physically, because sometimes people are really sick, and the physical demands of the caregiver are so significant. So it is so often a partnership and understanding for a patient who is that team for you. It may be a spouse, it may be a friend, it may be the children, it may be, other people, but understanding what is going to be helpful for that patient, understanding what that caregiver, the support needs. But I'd love to hear more from all of you.
Robin, you've had a unique lens in terms
Yeah,
of caregiver and patient.
With my wife, she was, by definition, a housewife and mother, which is what she loved. And being cared for was not something she accepted too easily. So I do most of it on the down low. She'd be sleeping, I'd clean the house. She'd be at home, I'd be coming home from work, I'd pick up the groceries, put them away once she went to bed. Things like that, because that would be the burden. If she felt she was a burden, that would nag at her. So just to make sure she didn't know I was doing this. And as the melanoma progressed, there was incidents of memory loss and mental abilities. So I slowly, a little bit at a time, took over managing the budget and the bills and stuff like that. Just, again, just on the DL. It all kind of meshed in without really being noticed. Yeah, she was really good about the questions, and I would write them out and then let her run any appointment.
Toni, what about you? Your caregiving support team that you had around you. What recommendations would you share?
Within our mucosal melanoma community, we put our caregivers on a pedestal. We realize they carry the heavy load. When a caregiver is doing their job, the weight of the love in the relationship, whether it's a parent, child, spouse, brother, sister, whoever it is, it's difficult to sit there and watch them struggling with cancer. And they do it, and they do it well, but they hide a lot of what they're carrying inside, trying to put on a front to be strong and be a caregiver. And so when we have caregivers, we encourage them to be a part of our community. We ask them to join us. We do 2 weekly Zoom meetings, international Zoom meetings, to bring mucosal melanoma patients and their caregivers together so that we can talk and share and compare and encourage each other. And we always make a special note of our caregivers that are there, because we know how important they are. But having a good caregiver allows you to be the patient. You don't have to focus on anything else except you and the doctor, and they take care of all of that. And sometimes we have a patient that comes in that may be a widowed woman who doesn't have anybody around, doesn't really have children nearby, spouse is gone, doesn't really know what to do. And so helping guide them to understand why it's important to maybe find a friend, find somebody that will go with them so that they can just be the patient in the room. But it's really important to know that that caregiver gets a break too, that they get a chance to decompress with what they're doing. My husband and I have been caregivers for each other, for both of us having cancer. And he's a much better caregiver than I am. He was still working at the time, and his employer was very understanding, and I was having to travel 3 hours each way to my cancer center. And the trips going over, the time spent together, when I look back on it, how precious that time was. Just the 2 of us getting to have time alone and work through this and deal with it. But he was just solid as a rock. He made sure he kept in his phone, he could pull it up today and tell me who I saw on any given day, what medication I was given, what time my next appointment is, everything. He kept all of that. And today, if I'm trying to have a conversation and remember what I did, he can pull it up right there, which is just incredible to me that he would do that. But making sure that that caregiver gets the support that they need. They need to be able to find a way to, fortunately, like my husband had a best friend that they were runners, and they would go and they would run and talk, and he could unload and decompress, and that's a critical thing for a caregiver to know too.
Absolutely. Brittanny, what about your caregiving team?
Mine's my partner, Merle, and he just supports me. And the best thing is he doesn't blame me for having bad days. And that's the best feeling in the world whenever you're having a bad day, just having someone to be there and say, I understand, and it's okay.
Absolutely. Let's switch gears for a moment, because Dr. Schuchter, you touched on this a little bit earlier in terms of all the digital demands now that are upon providers and patients, whether that's patient portals, telemedicine, artificial intelligence changing kind of those potentially changing those provider-patient interactions. So first question for the audience. So often now you get your test results into your patient portal, whatever test result that may be. Regular screening, something case. Raise your hand if you go in and read the patient portal and then you see something, you're not sure what it is, and then you Google it, and then it becomes this really long process before you had a chance to provider. Raise your hand. So I think a majority of the room. So first things first, I want to talk a little bit about that, but I want Dr. Schuchter, I'd love to get your perspective on, where all of this digital is really helping advance medicine and the patient-provider relationship. And then what are some of the things that we really need to think about in terms of those guardrails to not create maybe unneeded anxiety within our patient community? So I'd love to get your perspective, and I'd love to.
And for those of you online, many people in the room raised their hand to your question. I want to just first talk about the results being immediately available. Like it was a law passed by Congress to make information, it's your information, and making it accessible to you. And so it was a requirement that clinics and hospitals release this information immediately. I mean, it is a mandate for us to be doing it. And there's, a couple of kinds of information that maybe doesn't get released, but for the most part, laboratory studies and CAT scans, MRIs, PET scans are in that category of immediate release. And so we think it's good that you have this information, but it's also really, really hard because you actually often have the information before I do. And I say that to my patients now. You are going to see these results before I do. And I think that's really, really hard. And our radiology reports, they are getting a little bit better to use somewhat patient-friendly language, but not completely. I mean, I think patients are able to see impression and plan, no signs of metastatic cancer. So there's a relief there. But, 50% of the time, the report says small lung nodule, not sure what it is, could be melanoma. And so this is now the challenge for us, is dealing with this information and the calls, because we haven't even had a chance to review the information, and we're getting contacted. And, there's language in these reports that say collapsed esophagus. Now, that sounds like a really scary thing, but that's just a normal variation, but that's what's in the radiology report. There's lots of words like that. In fact, one of our conferences for our patients, we have the radiologist explain the terminology that's in the reports. So I think it's really great that the information's available right away, but can be very stressful. In the olden days where you would have to wait 2 weeks for a report or wait till you came into the doctor's office, I mean, that was not a good thing. So it's really great that you have the information. And then I would just say, give us a chance to see the information. And sometimes if it isn't good news and the cancer has gotten worse, we want to have a plan before we call you. And so we are, first of all, reviewing with the radiologist, really, do you really think that's what's going on? So it sometimes does take a lot of time to figure it out. The other issue is about how you're contacting your team. So again, by a raise of hands, how many are in a portal emailing their physician, nurse practitioner a question about a test result, or you want to make an appointment? And again, many hands are being raised. This can be really great, but the frustration for so many is that you're not getting anybody on the phone, and you're in a phone system. The other, and this is a big debate about, there is AI-assisted answering now, those machines. I mean, your messages. So AI can look at what you've typed, make a decision about how to triage that. And the issue of disclosing to all the patients in that practice that it's actually a computer that's doing the first screen as opposed to a person. Patients should be informed of this. So as Dr. Alan Halperin presented today, there's great new technology, and it, in the end, I think, is going to make care better, more efficient, more accessible for more people, but there are challenges, no doubt about it. And, from the pace with which we get the results, the ease that scans can be done, all of that is really good, but we are still catching up with a lot of the technology. So, sorry, a long answer, but it's a process, I'll say.
Appreciate the transparent and candid answer for our community. Brittany, when you and I, along with Robin and Toni, were in conversation in advance of today's panel, you said something really fascinating to me, which was, if my provider does not offer telehealth or a patient portal or electronic medical records, I'm not going to see that doctor. Mm-hmm. Can you give your perspective on that decision-making process?
Yeah, we're all going to have our personal biases, and I'm obviously a younger generation. Technology is, my phone's in my hand 24/7, 365. Like, I need all of my medical information right here, 24/7, 365. But also, it's like tiny things. Like, I work customer service on the phone all day. I I don't have the time to be on the phone with my doctor all day. I just want the test results to come to my phone. I can look at them. But at the same time, it's kind of like the internet. Not everybody has critical thinking skills. So there are always going to be those people that see it, stress out, and freak out, and message your doctor. So it's a learning lesson. It's going to be a personal learning lesson for every patient if telehealth is right for you or if it's wrong for you. For me, that's one of my bullet points. If you don't do telehealth, we're not.
Not putting a ring on it. Robin and Toni, your perspective on, digital and, hearing like 3 hours one way where maybe telehealth on some of those appointments would have been maybe a little bit easier, maybe not. Robin, you first, and then Toni, I'd love to get your perspective on what you're seeing as a patient and, in your case, a caregiver.
Yeah, well, I've really enjoyed well, at that time, there was no telehealth, that didn't exist. But now we have telehealth, and I use it really well as far as a simple question to the doctor's office over their messaging. But actually, I had regular appointments with the dietitian because of, I was close to being pre-diabetes. And so I had these conversations with this dietitian that made it so much easier to I don't know, somehow it's easier to talk to someone over a screen and a microphone than it is face to face. And so it's easier to say things and easier to sit there and write notes as they do it. So I like that, having that ability. I don't know that I wouldn't see a doctor if they don't have it, but that really, in my area, it's standard. It's standard of care to have that ability.
What about you, Toni?
Well, I'm in a really unique situation in that I have to travel a little bit of distance to see my oncologist for my routine scans and reports and all of that. And the schedulers do a great job of getting it done all in one day. So I go in early that morning, get the labs done, the CT scan, the MRIs done, go have lunch with my husband, and then that afternoon actually get to see my oncologist, and we review everything. And I like to be able to see what's in my portal in the reports, because then I'm able to write my questions down. And he knows that I'm not going to freak out if there's something in there, that I can be very rational. But I have a chance to look at the report, write it down. If there's a term or a word or something in there medical that I don't understand, I've got time to pull it up and look at the definition, what that means. We often laugh and say, well, the radiation oncologist must have been enjoying using his fancy words today, because he doesn't get to do that very often. But just finding that information and being able to process it, sit there and go through and then be ready for the appointment has been a benefit for me. But this is a topic when we have our Zoom calls with a lot of the other mucosal melanoma patients, the difference in some of them say, oh, I don't want to see it. I don't even look when it comes. I wait till my appointment. I don't want to know. So everybody's different. And, it's like, if there's not a right or a wrong. If you know you can't handle it, don't do it. If you can handle it and it's for a benefit, then sure, get in there and do it and read up and know what's going on in your world. So it just depends. I think it's a personal preference.
I think we can probably all agree too. There's a group of us that want to learn the big words. We want to know what they mean. We want to be as educated as possible on the whole thing, start to finish. So I don't want to be hidden from the reality of what I'm going through.
And that's like my general practitioner told me after COVID. He says, I learned more by my conversation with the patient than I do unless there's actually something physically you need to see. He says, it's the question and answer period that he gets all his information about a patient.
Yeah.
I think we have an opportunity for one or two questions. So I'd like to open it up. We have some microphones in the back. So raise your hand, introduce who you are. And for the benefit of Dr. Schuchter, we cannot answer any personal medical questions. So just want to make sure everybody knows that. Do we have any questions out there? Okay. Where's the back, please?
Hi, Amy Jardin. So I had Acryl, and I guess my thing when you guys were talking about, like, how do you respond to people when they say it's just skin cancer and everything? For the first year, I didn't know I had a rare melanoma. The only person that I can recall maybe saying anything like that was the nurse who called me over the phone. She stumbled over words before she said melanoma, and I didn't pay any attention to it because nobody explained it to me. I was referred to a general doctor. He did the surgery. He just said melanoma. I went to the oncologist for a visit. She actually didn't want to see me until I had my white lesion excision. She did not mention what type of melanoma. I saw her for my second appointment. I actually had to ask her what stage I had. And she was shocked nobody had told me. And I thought, well, who's the person who would tell me this? The general surgeon or the oncologist? And so I guess I'm just wanting to reiterate, follow your gut. And I really regret not seeing that melanoma specialist before 18 months. That's when I decided I need to see the melanoma specialist. And I hope more people go to them from the get-go. That first year, I deflected a lot of questions from people about you were in the sun, you were a farm kid, you did this and this, and people blaming the patient who has melanoma. And it just gets me so frustrated because all I say is we all have skin and it can happen to any of us.
Yeah. Thanks for bringing that up because my oncologist definitely told me I had stage 2A melanoma, like verbally at our face-to-face appointment. And so I went around for a year on social media saying, I'm a stage 2A melanoma patient. I looked at my chart one day and actually took the time to read it. I was 3A or 3A. I'm 3A. So I was just telling the world the wrong staging the whole time because my oncologist never told me.
Any other questions?
Any questions? Come on over here.
So you all talked a lot about the importance of the patient and dermatologist and oncologist and their staff relationship. What other doctors are important to be informed about your melanoma diagnosis, whether you're going through or you have overcome?
Well, I would add, yes, the dermatologist, as you said, and this, often the surgeon may stop seeing that person after they're many years after surgery. Not every patient who's diagnosed with melanoma needs to see a medical oncologist. So some patients with really low-risk melanoma, low risk that it could travel, those patients don't need to see a medical oncologist, though sometimes because a dermatologist or surgeon may not be able to give you the stage or may not be able to explain the whole thing, having the medical oncologist, even if they don't need to continue to see that person, really puts it all in perspective about this is really low risk, it's fine, and you don't need to see a medical oncologist or you do need to have scans. I do think for women who are menstruating, there's this question about different types of birth control. So I think if you have an obstetrician and gynecologist, I think that physician should know about the diagnosis. I mean, I really do think every provider that is seeing a patient with cancer should know about that diagnosis. Because if somebody has other types of specialists and have other kind of medical problems, that could inform decisions that we make about treatment. So if somebody had problems with their kidney, maybe we would avoid giving certain types of treatment. So I do think it is important for every type of physician, the primary care physician or family practitioner, if there's an obstetrician gynecologist involved, to have that information. One advantage of the EHR is that we are able to share so much more information than we could before. Some of it is sending an actual letter, but because we largely are on one EHR for the most part, Epic or a couple of others, we can actually see so much. And that is actually a huge benefit, this Care Everywhere feature that we can see everything. The other thing I just want to mention, and I'll let others answer, is I do ask my patients every visit if there has been any change in the family history of cancer. You know, more and more we understand that there are cancer syndromes and melanoma can be part of certain, like the hereditary breast cancer, BRCA1 and 2 is associated with melanoma. So sometimes when the patient then shares at that family reunion or Thanksgiving their diagnosis of melanoma, other family members come forward about a diagnosis. So it does affect sort of what kind of surveillance and monitoring. So if someone's had a diagnosis of cancer, do we need to be monitoring, for other types of cancer in a different way? We really pay attention to cancer screening guidelines. And sometimes the medical oncologist is saying, you need your colonoscopy, you need your mammogram. But still, sometimes is the gynecologist or the primary care physician. So I guess I would say alert the team. I don't know if you guys want to expand.
I would add that I think it's important to understand the role of a tumor board and make sure that a patient understands. You ask your doctor about the tumor board, because depending on
Do you
the...
want to say what it is?
Yeah, what is that?
You say what it is.
Well, okay. I'm assuming everybody in the room knows what a tumor board is. A tumor board is a collection of different oncologist specialists, depending on where your cancer is located at. If somebody's got anorectal mucosal melanoma, there's going to be a gastroenterologist there. There may be other types of surgeons. You want a radiation oncologist included, where they come together and look at the patient collectively and decide together as a team the best approach for treatment. Many times I'll hear someone say, well, I'm just going to my local oncologist and he's going to do this or that. And say, well, who has he talked to? Nobody. Well, wouldn't it be good, especially for women who have a gynecological mucosal melanoma, wouldn't it be good to have somebody like that on the team to also have some input in the decision-making of how the treatment's going to go forward? So they have to understand the value of that and make sure that there is going to be a tumor board.
I think the doctor we're leaving out here that you don't really think about is your dentist. Because, you're going to be treated with a lot of different drugs, a lot of different, they're going to have to know, and they might not, I don't know if they're on care everywhere or not. So they really need to be, they need a lot more information than the other doctors, because they aren't going to know anything about it. So you want to make sure your dentist knows about procedures and drugs and any treatment you're going through.
I've lost so many teeth since treatment.
Oh, that's excellent. Well, I want to thank you for this incredible panel. Dr. Schuchter, thank you. And by the way, such an honor to be sharing the stage with you as a luminary. Thank you for your service as the past president of the American Society of Clinical Oncology last year, where melanoma was front and center, something I know everybody within our melanoma scientific community was so thrilled to see, and I appreciate your leadership on that, and also the collaborative work that we do with the Tara Miller Melanoma Foundation, so thank you for that. Toni, Robin, and Brittanny, thank you for being our voices, our eyes, and all that you do for patients out there everywhere in the different ways that you do it for melanoma community. We're so grateful to you. And now, with great pleasure, I'm happy to bring up Renee Orsioni, the Associate Director of Communications and Engagement for MRA. Thank you.